answer to your question is no. In the main, my experience is that it's the patients that go and seek someone else, not the other group. Sometimes they do, but that's not the larger group. I think that the patients work out after a few teeth or whatever that things aren't working and they go and seek someone else themselves because their problem continues. So they're well motivated to go and seek other advice. Unfortunately, it's usually not those that are referring, sadly. I think the most important thing probably that happened in recent times in terms of understanding the disorders being brain imaging. This is a picture from the first thing that we did on the subject, showing the brain in this little activation area. At the time, I have to say, it was didn't really expect it to produce all the things that it did. So what at the time, it was generally thought that cluster headache was a disorder of a large blood vessel at the base of the skull that become inflamed and would dilate. The problem with that is that there are several problems with that. One of them is that if you look at enough patients, you studied enough patients, not all of them have dilation, so that's a bit of a drag. And the other problem is that it doesn't explain most of the symptoms, but it's an idea people have. So what we started to do, and others have reproduced this now, brain imaging. So functional imaging is a technique where you can see what, you can look inside the brain to see what it's doing. So the classical example is if I take my hand and I start wiggling my fingers like this, the other side of my brain will light up because the movement part of the brain is crossed, it's on the other side, and it's up at the top here in the cortex, and it'll light up when I do this. Because when you use the brain, when the brain is active, it changes its requirement for energy, for glucose, and along with that produces some chemicals that will dilate blood vessels locally, give it more blood flow, so to speak. So this little marker is a marker of turning on of nerve cells within this area of the brain during an acute cluster attack. I've always thought it's a testament to the involvement of yourselves, of patients with cluster headache in the problem, but you are happy is not the word, but put up with going for these scanners. You have to have this head thing clamped on, and then you get in the scanner and have to lay there, and then we do the baseline scan, and we'll trigger an attack. And it's bad enough to have an attack and be able to wander around and treat and so on and so forth. It's a whole other thing to go into a scanner and lay still while the attack is occurring, just to do these images. It's a real testament to what people are willing to do to understand the condition. And it paid off quite considerably because it pointed to a single area in the brain that seemed pivotal in the expression of the attack, which people hadn't thought of before. We've thought of a little bit, but not in the detail like this. It's a small area of the brain, which we've been thinking about ever since. Makes a lot of sense. This area of the brain has some important connections to. It has important connections to these nerves that cause the eye watering and redness and so forth. So that makes sense. And it's not too far away from an area of the brain that's involved in sleep-wake cycling. And one of the real markers again of the condition is the way it cycles, either on a daily basis or on a yearly basis. I often think if I understood how bears hibernate, how that circadian thing works, and understand a whole lot more about an episodic cluster headache, where it comes on at a particular time and then it goes off, comes on and does that year in and year out. So these are the first of the brain imaging studies. One of the more important clinical things that happened a couple of years ago was to start to understand how to use verapamil in cluster headache. It turned out that, some of you might be on it, that it turns out to be an interesting preventive medicine, although something which you have to take all the time to get its useful effect. There are two things about it. One is that you have to use it in, it's called a calcium channel blocker. The thing is, you have to use it in doses that almost certainly are affecting something else, not the calcium channel. Because the dose, typically heart doctors will use it at 120 or 240 milligrams a day. And typically, as you can see here, we were using it in doses getting up to 600 milligrams a day and sometimes north of that up to 900 or so. So the doses of this drug that are used in chronic cluster headache are quite industrial. And either the calcium channel that you've got is different, mutated, or the effect of this drug is on something other than the calcium channel. That's not being worked out. Well, it's low-hanging fruit. One of the many things that can be done is that I think could be done relatively simply because there's quite a, people either respond or they don't. There's going to be some what we call pharmacogenomics in that will explain this. The other thing we found is so you have to use a lot. The other thing we found was that sometimes the heart will play up. And what happens is that the heart, the way the heart works is probably knows the big chamber at the bottom called the ventricle and the chamber at the top called the atrium. And the way it paces itself is there's a pacemaker which drives it from the atria, drives the ventricle, so it goes like that. If you block that pacemaker in something called the node, AV node, you slow that down, you can cause the person's heart rate to slow down, you can cause them to pass out, indeed. And as doses of verapamil go up, this little marker, the distance between that little blip and here, which you see is lengthened and then gone back to normal. And verapamil causes that to happen. It's important for people on verapamil long term to get these ECGs done because it can happen after even 6 months of therapy if the person has delayed prolongation of this marker. That was news, and it's been, we published it in a journal called Neurology a few years ago. It's been important in driving the way physicians look after people with cluster headache. It's a relatively simple finding, but it's important, particularly for people who are on cluster headache. It may end up being important in terms of understanding the pharmacology. I'll talk a bit about imaging, a little bit more about imaging. One of the ways you can work out the finding in the brain in cluster headache, this change that I've shown you another verb. The other better way of doing that. This is, as you can, this is looking forward like that. So you imagine you make a cut. This is looking straight on. The next one that I'm showing you is looking across this way. And this is the same area in the brain. You see, it's not present here. The difference is that your left is a cluster patient, and on the right were German medical students who had capsaicin. It's an essence that's effectively what makes chili peppers burn. So you take the essence of that and you if you inject it into the forehead under the skin, it burns. It's very unpleasant. Very unpleasant, as you might imagine. Imagine chewing into a chili pepper but injecting it under. So what's nice about it, if nice is a good word, is that you can get a really bad pain up here in the forehead, really unpleasant. I suspect not as bad as having the cluster, but nevertheless bad enough. And you don't get activation in this area of the brain. It seems that you don't get it in migraine either. And so it seems that this area of activation is specific, well, yeah, I think specific's fair, for this class of problems, particularly we saw it in cluster, and I'll show you in the other conditions actually all these TACs it seems to be present. There's something important about this area of the brain. The other thing that you can see, other things you can see on brain imaging just for interest, as you see that area here, this is called the cingulate cortex. It's probably an attentional area in that when something's happening that interests you, or perhaps your attention, like a cluster attack would, that this area of the brain lights up. That area and these ones here, they're called in something called the